We're now going to proceed in the evaluation of the peripheral pulses of the lower extremities. And the first pulse we will evaluate is the popliteal. The popliteal is one of the more difficult pulses to feel, even though the pulse itself is relatively large and relatively strong. The manner in which you evaluate the popliteal is by placing your hands on the patella and placing your other fingers in the popliteal fossa and trying to sandwich the popliteal pulse between your fingers and the bone. You may want to elevate the leg slightly, but do not have the patient elevate his or her leg. After one pulse, one goes to the other side and evaluates the other leg, as I'm demonstrating now. We're now going to move on to the distal pulses, the posterior tibial and the dorsalis pedis. The two distal pulses which we routinely evaluate are the posterior tibial and the dorsalis pedis. The posterior tibial runs along the leg down here and courses around the medial malleolus. To evaluate the posterior tibial artery, you place your hand on the artery and push it up toward the medial malleolus, palpating the artery against the bony structure. You can do this on both sides, as I'm demonstrating now. The dorsalis pedis artery runs along hallucis longus, right here. And you can palpate it by placing your fingers, never your thumbs, here and on this side, and they can be palpated simultaneously. And that concludes the evaluation of the peripheral vascular system.